right, welcome to the show, where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today on the show, we have Johanna Vidal Phelan. She is a pediatrician, and she wrote the Kevin MD article, Bottles and Pacifiers, Advice from a Latinx Pediatrician. Johanna, welcome to the show.
Thank you so much for having me.
So we'll get into your article in a little bit, but first off, can you share your story and your journey to where you are today?
Absolutely. Thank you for the opportunity. So I was born and raised in Puerto Rico. And, one of the reasons that inspired me to write the article is that I work with many Latino families. And definitely my journey has been influenced by my culture, the language, my first language, which is Spanish, and how to outreach to a community here in the United States. So I've definitely always inspired to work with children, families, and mothers. And definitely that has been what has really pushed my career forward here in the United States.
Tell me some of the challenges that immigrant populations face when trying to receive care in the United States.
I think it is knowledge and understanding of having access to the correct information. Also, there's cultural sensitivities and racial and ethnic sensitivities that I think we all need to be aware of and understand, especially in healthcare. I know there's a lot of focus right now on social determinants of health, but definitely understanding the true impact of social determinants of health in all our patient populations that we serve is really important. When I counsel and mentor medical students, I tell them there's no way you're going to know everything about every single population, but to ask the right questions to show that you care and meet your families and patients where they are is really something that is so important to deliver good care.
So give us some examples of some of the cultural sensitivities that you encounter in the patient population that you see.
I think understanding where the families, in my case as a pediatrician, I always talk about families, but where the patients or families are coming from. Some sensitivities that you need to be aware of could be based on religion. In my case, I counsel a lot of families about the importance of good nutrition in the development of a child. So understanding some of the foods and items that are associated with family and culture is important, and understanding where to meet the family halfway to make the clinical impact that you want. So a perfect example I do when I do educations on management of pediatric obesity has been that when you work with a Latino family, if you advise a family to eliminate all rice from a diet, it's not a successful technique. The family is probably not going to be able to sustain that long term because rice and beans is such an essential part of the foods that we eat. So where do you meet the family where you can take some of the foods that they mean so much, it's part of our culture, meet them halfway and make them healthier and choose alternatives so that you can achieve your clinical goals, which may be management of type 2 diabetes, for example, or having a child have a healthy diet.
All right, so let's transition into your Kevin MD article, Bottles and Pacifiers, Advice from a Latinx Pediatrician. Now, for those who haven't read the article, can you walk my audience through it and maybe share the story of why you decided to write it?
Thank you so much for that question. I actually wrote the article first in Spanish because I was really aiming to deliver a message that I find I say constantly to my Latino Hispanic families. And I noticed in clinical practice that my Latino families tend to use the pacifier and the bottles a lot. And we have a lot of conversations, and again, meet them where they are in regards to the use of what they call in our Caribbean culture, we call bottles botella, and we call, or babas. And then the pacifiers, we call them bobos, which is something that we use in the Caribbean islands to refer to them. And there is a connotation and association of love to give a bottle and the binky to your child is it means you love them. But then we're trying to meet the family where they are and understand that doing that causes dental cavity and dental decays. I've seen a lot of anemia in my Hispanic families because they drink too much milk from the bottle or they're drinking too much juice from a bottle, and then what happens, the child is not eating the nutritive foods that are going to help them grow. And so understanding where grandma, abuela may be coming from, an aunt or titi may be coming from, and saying, I know giving the bottle to the baby is something where you love and nurture your child, but there's other ways to do that in a way that's healthier. And let's discuss the true habits. Is it the child wanting to to take the bottle, or is it abuela sneaking the bottle? And where are we with that? And explain to the family in a way that is simple, that they understand why some of this behavior has to change in order for the child to be healthy.
And when you talk about this, in general, what are some of the responses that you get from the families?
Many times I hear, oh, I didn't know that, or this is the way we've been doing it for a long time, or this is how we do it in Puerto Rico, for example. So it really has so much validity when, as myself as a Latina physician said, oh, I remember when I was in Puerto Rico, and I remember, when my grandma sneaked a bottle when I was little, I understand that. And so they're like, oh, you understand where that come from? I'm like, absolutely. But at the same time, as a pediatrician, I want to tell you that as part of your preventive care, I want to be sure your child has healthy teeth, is not having anemia, and that your child have the amazing opportunity to eat great foods that are going to help them grow healthy. I think I do a lot of preventive care, and this is a conversation that I had with families way before the 1 year mark. So when the child is turning 4 to 6 months of age, I'm already having those conversations to let them know, let's introduce the sippy cup earlier. Let's start weaning the binky. It's okay. Your child is going to be okay, and reassure the family that though they may see this as part of the cultural tradition, that we're going to do the best we can with our child and our patient here in the United States.
I have to admit, it's been a while since I've studied pediatrics in medical school. So for those non-pediatricians out there, you talked about some of the downsides about using the pacifier. Can you go into a little bit more detail about some of the health effects? You mentioned tooth decay, you mentioned nutrition effects. What are some of the other effects of using a bottle and a pacifier?
I think that we need to determine and discuss what is normal, for using a pacifier and what is not normal. So it is normal to use a pacifier when you're baby in the first 6 months of life. Babies like to suck, and it's a way that they can calm, it's a reflex. So using the pacifier in your child that's less than 1 year is okay. What I'm trying to avoid is having a child who is 4 years of age with a pacifier that now has some dental malocclusion and maybe even has some speech delay, because when a child is developing language, if they have a binky and they're sucking when they're older, like at that taller age group, they're not going to talk. And you really want to develop those language skills. The bottle is a way that we feed our babies. If you're not breastfeeding your child, then you supplement or use a bottle. But the bottle is to be used until really 12 months of age. After 12 months of age, your toddler is developing skills where they can drink fluids from a sippy cup. They can eat food and they chew food. And so I always compare it to an adult. We don't walk around with a bottle drinking milk all day long. We drink fluids with our meals, and we want to be sure that we eat our meals first and then we drink the fluid. So that's how we do it with little kids too. I think the bottle is a passage of right. You obtain all your meals, all your nutrition when you are a newborn and an infant from a bottle. But as you get older and you introduce solids, children eat food. And so that's the main source of nutrition. After 12 months, there's really not no need for formula. So now you're changing from formula or breast milk to milk or continuation of breast milk. And breast milk will be a fluid in addition to the nutrition foods with protein and grains that you want to offer your child to continue growing.
You mentioned that there was like a Hispanic influence in terms of the families who show love by using the pacifier in bottles. Is this purely restricted to the Latino population, or are there any other cultures, as far as you notice, that do the same thing?
I've seen it in other cultures, but it really perseveres a lot in the Latino community. To the point where we name the bottle differently. We call it a baba, and there's something about baba and bobo, which is very cute in our Puerto Rican culture, that is just almost related to love, no? And so I think that it is a message that I discuss with my families all the time, and it's almost sometimes controversial because I may be delivering that message to mom, who is in the room with me, but then I need to talk to a grandma too, and I need to reach out out to the other caregivers. So I use other ways, written materials, information, communication, asking questions, and then engagement, because this is a shared decision too process, and we want the families to have the knowledge and understanding of why this medical recommendation is being made that is good for their child.
We're talking to Johanna Vidal Phelan. She is a pediatrician, and she wrote the Kevin MD article, Bottles and Pacifiers, Advice from a Latinx Pediatrician. Do you have any advice for those clinicians who may not be Latino in terms of dealing with this issue in the exam room?
Yes, I honestly, with everything else, I ask, my mentees and students and other physicians to ask questions. I think a lot of our families, and I learn from all cultures, are so interested to share their background, their culture, and that sensitivity that you're taking the time to ask that one or two extra questions really makes a big difference for the family. So if you notice one of your families is like, the child is now 2.5 years old in your office getting their well child visits and they're still walking around with a bottle, sometimes we need to ask the question instead of saying, don't do that. You want to say, why? And can you tell me why you're still using the bottle in your 3-year-old child? And then meet the family where they are and identify those barriers and provide knowledge so that they understand why your advice is to reduce the use of bottles and use, sippy cups or other tools. And I think that's a very good example of everything else in medicine.
Now we're speaking in the second week of December, and of course, switching topics to coronavirus and COVID, which I'm sure you're seeing in the clinic. Now, from the Latino population perspective, are you seeing any specific issues that may be applicable to them when it comes to COVID-19 and coronavirus?
Absolutely. We all know that, Black families and Latin American families have been heavily affected by the pandemic, by COVID-19. I think one of the issues that I noted early in the pandemic is lack of information in Spanish to reach the communities. And so I really encourage families to ask questions to their providers. If they are scared, overwhelmed, they don't know what to do, you have a family member or a child who is sick, is to call your pediatrician. Another message that is so critical to deliver is that families are scared, but children still need their well child visits. Children still need their immunizations on time. We don't want to change the pandemic COVID-19 situation for a measles epidemic or for your child to have a vaccine preventable illness. So if your child needs well child care and your child needs immunizations, call your doctor today, make that appointment, because these appointments are so critical for the growth and well-being of your child.
And my final question, what is your take-home message that you want to share with the Kevin MD audience?
I think that, our Latino community in the United States continues to grow. We are now 18, almost 19% of the United States population. But for physicians and our physician workforce, it's only 5.8% of physicians in the United States are Latinos and 2% are Latina women. So we really need everybody to be able to have this cultural knowledge and sensitivity to deliver care to all families based on culture, ethnic, religious background, with a way that provides empathy and is in diversity. While we continue to increase the number of physicians, underrepresented physicians in healthcare, it's going to take a couple of years and it's going to be an effort. We all need to be part of the solution. And so as we care for these families, learn from them, ask questions, be empathetic, and continue to mentor other students, especially those that are underrepresented, so that we increase representation of minorities in the healthcare workforce.
Johanna, thank you so much for your time and insight. And thanks again for being on the show.
Absolutely. Thank you so much, sir.